Hi, I'm Jackie Thelian, and welcome to Key Coding Tips. Today we're going to talk about how ICD-10 affects our clinical documentation. Because ICD-10 includes a more robust definition of aspects of the diagnosis or injury, the documentation will require more specific documentation. Some of the ICD-10 codes will differ in only one parameter. For example, 25% of the ICD-10 codes are similar with the exception of laterality. ICD-10 now includes in the ICD-10 descriptor whether the illness or injury is on the left, the right side, or bilateral. In cases where there is no bilateral code, you would need to report both the left and right codes. An additional 25% of the codes will differ only with the exception of whether it's an initial encounter, a subsequent encounter, or sequela. For example, for fractures, an initial visit would be reported as long as the patient is receiving active treatment for the fracture. Active treatment is described as surgical treatment, emergency department evaluation, or even evaluation by a new physician. Subsequent treatment is to be used once active care has been completed. An example would be aftercare, cast changes, or removal. And ICD-10 guidelines define sequela as the residual effect after an acute phase of an illness or injury. For example, a scar would be the sequela of a burn. Although ICD-10 contains 1,800 codes for fractures, there are approximately 50 different recurring concepts. And they are the category and documentation requirements. Let's take a closer look at what is required. Okay, so this slide basically lists a table, and it talks about the different categories. Categories would be whether the fracture is healing, whether it's a fracture type, and the clinical documentation requirements you could see are listed under each of those various categories. For example, if we're talking about healing, they want to know, is this fracture delayed healing? Is it non-union? Is it malunion? So this is the type of documentation we would be looking for in that patient's note in order to select the appropriate ICD code. Some of the changes actually come to some of the diagnoses that we've been coding routinely, such as hypertension. So in today's Key Coding Tips, we're going to take a look at some of those categories which have some really big changes. Hypertension is one of those. For those of you who have had difficulty utilizing the hypertension table, well, here's some good news. For ICD-10, it is gone. Coding hypertension is so much easier with I-10 as opposed to I-9. The big change with hypertension is the fact that the concept of benign or malignant as it relates to hypertension no longer exists. Therefore, the hypertension table formerly utilized in ICD-9 is no longer required. Hypertension is now identified by the type of hypertension, whether it's essential or secondary, etc., and any causal relationship such as renal or pulmonary. So now when we go to find our codes for ICD-10 for hypertension, inherent in the code itself is that relationship, whether it is related to heart disease or heart failure, or it has some renal vascular hypertension. Okay, big changes in asthma with the way we define asthma. So there's a huge terminology difference. When documenting asthma, you need to identify the cause. For example, a cough variant, whether it's related to smoking. You then need to identify the severity of the asthma as either being mild persistent, moderate persistent, or severe persistent. This is then followed by temporal factors such as whether the condition is acute or chronic. We have charts to help us define the differences between mild persistent asthma and moderate persistent asthma. As you can imagine, this definition might be different from physician to physician. So we do actually have some charts which would give us some definitive guidelines. For example, Mild intermittent would have symptoms less than 2 times a week and normal in between episodes. The exacerbation would be brief and nocturnal symptoms would most likely be twice a month. Indicators for lung function are FEV or peak expiratory flow rate. There are a lot of specialty-specific reference guidelines that are absolutely free on the CMS website. I would urge you to click on this link and download those that are relative to your specialty. They're written in simple English. They're very, very helpful. In addition, there are Medscape modules. Once again, absolutely free. You could click on this link. It's on the CMS website, and it gives you the road to ICD-10. It gives you processes for implementation. It has a lot of documentation requirements, and they're very helpful. Again, written in straightforward English. If you have additional questions, please remember to ask them in the comments section below. And remember to stay updated and subscribe to Key Coding Tips. Thank you for watching.